beautiful people, and welcome to Girlfriend Therapy Session with Dee. I am your host, Dee Bryant, and today's episode is a special edition of Girlfriend Therapy Session. Today, we're going to be talking about breast cancers. I have a panel of women here with me who are breast cancer survivors, and I want to introduce you to them. This is Jeannie, and we have Myisha, and we have Shirley. They are all breast cancer survivors, and I just want to say, I understand that this is a delicate subject matter, and we're going to treat it as such because on Girlfriend Therapy Session, we are the village that surrounds women, and we are a podcast that uplifts and encourages women, and their voices is going to inspire those who are walking um, the walk right now with breast cancer. Their voices is going to give them hope and inspiration. And for those survivors, we really have heart for the survivors, and then we also have heart for those who are taken. So I want to do a moment of silence for those who fought the fight of breast cancer and didn't make it. So let's have a moment of silence to acknowledge them. Okay, now we're going to begin. The first thing that I want to read is a medical disclaimer. This podcast is for informational and inspirational purposes only. The content shared is not intended to replace professional medical advice, diagnosis, or treatment. Listeners should consult qualified healthcare professionals regarding medical concerns. Individual experiences and outcomes may vary. And so I want to also um, talk about the statistics of breast cancer. According to the SEER program, part of the National Cancer Institute, 1 in every 8 women will be diagnosed with breast cancer in their lifetimes. While Black women are diagnosed at similar rates as white women, they are about 40% more likely to die from breast cancer, often due to later diagnosis and more aggressive form of the disease. When breast cancer is found early, survival rates can be as high as 99%. Breast cancer also affects men, with about 1 in 833 men diagnosed. These numbers remind us how powerful early detection and listening to your body really is. Okay, so we're going to begin. Okay, so this is going to be a roundtable discussion. And with this delicate topic, we don't want to be rushed, right? Because I want everybody to be heard and seen, and that's what we do here. So, so my question is for all of you, how long have you been a breast cancer survivor?
I've had breast cancer 3 times, and the first time was about 36 years ago.
Mm, wow, wow. And you,
I was
Myisha?
diagnosed in 2014, so it's been 14 years.
Mm,
And for me, I've had breast cancer twice. 2017 in September was the first diagnosis, and then December of that same year was the second diagnosis. So it's going on about 7 years for me.
oh, wow, wow. Well, how did you first learn that something was wrong? Um, When did you suspect that you had breast cancer?
Well, I just adopted my daughter. She was months old and she was teething and she bit her bottle and bumped me in the breast. And I went, ow, and it hurt it.
Mm-hmm.
So when I felt it, I felt a knot. I said, oh. And that's how I found out.
Mm.
Went to the doctors and they did a biopsy and that's what it was.
Mm.
Yeah. So she was like my, even though I saved her life, people say, you saved her life. I said, she saved mine.
Yeah, yeah. If it wasn't for that,
I
right?
would have maybe not known that early. You know,
Mm.
it went on.
And what year was that when that happened for you?
89.
89.
I would say, yeah, about 90 probably. Because she was born 89, so in November, so I would say 90.
Okay.
Yeah.
Because with that being said, that lets me know that technology has changed a lot since then.
Mm-hmm.
So in that during that time, what was technology like? Because when we spoke, you said something about the difference between that breast cancer and then when you had it the second time, it was a change in technology. You think?
Yeah, the first time they took out 16 lymph nodes to see if cancer went in. The third time, they put some kind of medicine, they shot it 4 times in my breast. And what lymph node attacked that, whatever they put in there, it went after that medicine. And that's how come they found it was only a 1. So I got only 2 lymph nodes taken out on this side.
Mm.
But yeah, that was pretty much the difference.
Yeah.
Also, they laid me on a table with a hole in the middle, and I had to put my breast into the hole. And they raised the table up to work underneath the table. The last time, they sat me in a chair, strapped me in, and pushed me to the mammogram machine. And they raised the chair up, so I'm sitting up was better, relaxed.
Mm-hmm.
Then cramped up on the table and can't move. Yeah, it was a big difference.
Yeah, difference in technology
Mhm.
change. Wow.
Same thing. They still did all the, what they had to do the first time.
Mm-hmm.
But the way they did it was different.
Right, right. Yeah. Okay. Well, what about you, Myisha? When did you first learn of your breast
Breast cancer.
cancer?
Well, I did self-examinations very regularly because of my profession at the time. I was a medical assistant, so I
Mm-hmm.
did that. And one day I just noticed a change and went to the GYN, asked for the exam. They rushed through my exam. I asked them to go a little slower to feel what I knew was different.
Mm-hmm.
And they still didn't feel it, so I just asked for a diagnostic test. And because of my age, it was like, you don't really need it, but
And what was your age?
35
You was
at the time.
35. So that's not the recommended age
Right,
for
it's 40.
mammogram.
Right,
Yeah, it's
it's
40
40.
years old to get a mammogram. So
But if you have family history, so I actually lied about family history just so I can get my test.
and sometimes you have to do that because you have to be your own advocate for
And
what
my
you're
mother
trying
is
to do.
adopted, so you don't know my medical history. You know what I mean? So
Right.
I actually, because of me, I was like the precursor for the family. I got the genetic testing, so I was the person who could tell them if they had to worry genetically about the breast cancer. But it wasn't genetic, so that
Mm.
helped the whole family.
Right,
Yeah.
right, right. Mm.
Yeah.
And what about you, Shirley?
So for me, it was a kind of different scenario. So I had been going regularly to get my mammograms, and I was being brought in every 6 months because they were seeing calcification and density in my breast. And at the time, I was much more bustier than what I am now. And with that being said, I also noticed that I had a rash that I had never had a rash of that sort before in my breast area. Went to the dermatologist. They gave me cream, treated it, but I still wasn't satisfied with it. I just thought this is odd the way it appeared. And it didn't really clear itself up properly. Then the pain started. I started having sharp pain. So, long story short, is when I got the biopsy done, it came back positive for DCIS in suit, which is ductal carcinoma in suit, which means that the breast cancer was isolated to my breast ducts, which is where, if you are lactating for a woman, where the milk would be produced.
Mm-hmm.
So that's how I found out for me.
Wow. Wow. Oh, wow. Well, what was your reaction when you received the diagnosis? I mean, I can only imagine the devastation. What was your reaction when you received the diagnosis?
I was sitting next to my husband, and he was holding my hand, and he said, the doctor said, "Well, I just want you to know it's cancer." I think I turned ice cold. It was like, it was, you know, I just turned real cold. Second time was pretty much the same. And the third time, it was like, oh my God, again? Yeah. So, but it's never good news. You don't feel great about it. You just look for the next chapter. Like, I gotta get through this.
Mm-hmm.
And and I just fought my way through it. I had to go through it by myself, but I had a whole, people around me, but I had to go through it regardless. And I knew if I didn't go through it, my end result would be not good. So I knew I had to fight my way through it. Just do it.
Yeah.
So I did.
Yeah, that's hard. That's hard.
Mm-hmm.
What about you, Myisha?
Oh.
What
was the question?
That's quite okay, girl. That's quite okay. Okay. What was your reaction when you learned of your diagnosis?
I don't know. I think when you're in the medical field, you kind of already know. So you, like, when they took the images, I took a picture of the image. I looked up the image versus benign and malignant being cancer. I wanted to know what they look like. It was cloudy. Mine was cloudy. So I was like, I have cancer. I already knew. And they had me sitting there waiting for the radiologist to tell me the results instead of letting me go home. And so I was like, okay, I'm waiting. So they know something. You know what I mean? So I was already prepared. So I feel like I just did a big gulp and knew what he was going to say. So I wasn't surprised. But I went home and it was on my mind. I thought about it. And, it was emotional. And I had young kids at the time. I think my oldest was in ninth grade. The youngest, well, the middle child was probably in fifth grade, and the youngest was in second. So it was like the oldest knew about it. The younger ones didn't know.
Wow.
And they were scared. You know what I mean? So it was more, everybody said I just wore a smile the whole time, and I just internalized it and fought. I didn't really live scared about it, I guess. So that was my reaction.
Wow.
And I, like, in my profession, I work with people who have it. So I was always getting them through it. I work as a hairdresser, so I would cut their hair and have them look for growth instead of waiting for their hair to fall out. So I kind of went through the things that I told people to do. So I always just
so your profession is in hairdressing, and Myisha caters to cancer patients and help them with their hair because doing radiation and chemo, people lose their hair, and you're in that profession to help women through that. I think
so they in
that's
turn helped
awesome.
me.
I think that's really awesome what she does. So yeah. Okay.
Thank you.
Okay, Shirley.
So for me, I too experienced something similar to Jeannie, where I was numb, but I also had a different approach because by that time I had already had cancer 4 other times, 4 different types of cancers, not unrelated to breast cancer, actually 3, because each one of the breast diagnoses are considered separate cancers. So I
Yeah,
remember.
wait a minute. I want to also mention that what you're just speaking about, that Shirley is a 5-time cancer survivor. So, okay, go ahead.
Yeah, so I remember when I got the call, I was at work with one of my employees. I work in research and development as a director of clinical data management. So I deal with clinical trials and things of that sort. And I remember when the call came through, this particular day, I happened to be working late and it was close to 6 o'clock. And my employee had already gone through cancer with her husband of some sort. So when the call came in, she said to me, "Do you want me to be with you with the doctor?" And I said, "Yeah, come on in." And when he told me, I got cold. I was like cold. And in my mind, because I had had cancer so many times, I always said to myself, I was questioning God in my head. I was thinking, God, again, are you serious? This is 3 times, really? Can you pass it around? Not that I'm wishing it on someone else, but that's exactly what was on my mind. I'm like, why do I have to keep being the victim of cancer? So that was my immediate thought. And then just digesting how I was going to tell my 2 children that, mom has cancer again. And this time it's worse than the other cancers that I had. This is more deadly. So for me, it was just like you said, it was a numbness, and then just going home and saying, just rationalizing it, and with that, you everybody does, but you take a lot of emotions with you, right? First, you don't even want to tell people, then you're angry. Then you kind of settle with it and you kind of push yourself every day to go forward with it. But I was quite numb as you was, but I did have a lot of questions for God. And I have to be honest, I was angry with them. I was angry with them. And only through the grace of God did I eventually start going through it. And, I brought you through these many times, Shirley, and I would say to myself, what's the lesson in this one? But as we go on in the podcast, our lesson and our hope here now is that we're all sharing our testimony here and how God has brought us through.
Yes, yes, yes.
And hopefully it helps someone.
Yes, most definitely. Okay, so once you learned of your diagnosis, um, what type of treatment did you receive, or what type of treatment were they offering you, and did you have to make a choice in your decision making of treatment?
Well, they tell you that everybody gets their own cocktail, so everybody's treatment is always different. Yeah, so I got surgery first. I had a double mastectomy, and I had the breast removed, the stomach fat taken to form the breast because I didn't want something foreign coming back into my body.
Right.
They give you the choice of breast implants, but I'm like, but doesn't that have maintenance? I don't want that. Like after 5 years or something. So I did the stomach fat to form the breast. That's a flap surgery, and then afterwards chemo. So that was my treatment.
Wow.
Yeah, and for me, it wasn't a whole lot of choices, right? So the type of procedure, like you said, so I was offered the flap. So I didn't do the flap. I actually have the implants and put it. I did have a double mastectomy as well. And I had 34 treatments of radiation that lasted from that November of 2017 until January 9th of 2018. So 5 days a week. And the lovely thing about it is that if it's a holiday, they still factor you in. They rearrange that schedule because you don't want to have that treatment broken. And I've had similar, prior to the double mastectomy, first left side, I had radiation because when I was diagnosed, it was only one breast that was involved with the cancer. So I had radiation done on that. Then in December, when I found out that I had cancer in the right breast, I was like, I'm not doing radiation again. For me, it was traumatic. it brings its own level of symptoms with it. And I just couldn't do it again. Had they been diagnosed at the same time, I would have said, okay, let's go through it. But to go through, every woman doesn't experience the same thing, but I experienced severe burns and other things that are associated with it. So then I decided, after being diagnosed in December on the right breast, it took me 4 months to get it together. Now, to be honest, my mother is deceased. I went to the cemetery. I cried on her grave. I was looking for my mother or my father to comfort me, to tell me what they thought, and it wasn't there. But I did go to the cemetery and I talked to her quite often, and finally God answered and said, take them off. So I did have the double mastectomy. But as you said, it led up to 3 lumpectomies prior to that, and then I had them take them off. And I would just say it's not common to have radiation and then a mastectomy. They usually want you to do one
First.
or other, but not
Or the
like
other.
what I did. So
Yeah, okay.
and then I had implants done immediately instead of having them take them out and then what is that thing called? I forget where they injected.
The suction thing, like
Like when
had
they
it sit
start
there.
preparing the muscle to receive the implant. I can't think of the
What
name
is
of
that
it.
thing called? The placement thing.
It's like a placement, and
It'll
so
keep
they
it there.
inject it. Yeah. So I just didn't do it. I told them to do it all at one time, and because I did that, I experienced spasms, and I experienced tachycardia, which is your heart racing and so forth. So
Wow.
that led me in that, and the lymph nodes being removed. I spent almost 6 months in physical therapy, just trying to get my arms to work again, and to help me breathe properly and to help control the spasms, because normally your chest is not used to having something artificial in it,
Right.
which is different when you have an implant that's done. For me, they lifted my muscle in my chest and put the implant under. So that caused my normally for a female, that's flat. And all of a sudden you're putting something, you're wedging something under, so it starts spasming.
Yeah,
And that,
yeah.
all I can tell you that comes with its own level of excruciation and pain and things with with breathing and things of that sort. So that's how it was for me. That the treatment, and then we can go from there.
Mm. What about you, Jeannie?
Well, I think it took the medical team at the hospital that gave me, because I had to see I had to see the the chemo doctor first,
Mm-hmm.
then the radiation doctor. But it took the medical team to keep, like, they were upbeat, they were, and that helped a whole lot, because um, just like people would say, or statistic, they say, it takes a few muscles to smile, but a whole lot of muscles to frown. So to get through things, you need a team. I had a team. I finally got one. I didn't think I needed one, but I did get one, and that was part of the healing. Part of the treatment was to stay upbeat, happy, um, and so I prayed, of course.
Mm-hmm.
That was always a must. And my children, I have 5 sons and a daughter, and a host of other kids that never wanted to go home, that I was, they kept me moving. It's like I live for them, not for me, kind of thing. And but it was important that I kept that upbeat in my life, and that's what helped. The treatment all 3 times were different. The first time I just had a lumpectomy and radiation. Um, Second time I had chemo, which took all my hair out. And I have to say, I knew it was going to come out, so I talked to myself. And every day I got up, I had a mirror at the end of the bed on the wall. And I would get up and I would do like this. And I would see my hair drop. and I would say it's still there. But I thought it was going to come out all at once, but it didn't. But my head was sore. I kept rubbing it. Middle of the night, I'm massaging it because it hurt it. And she said, well, if you cut your hair off, I said, that's going to stop the pain. Give me the scissors. So I asked my oldest boy if he'd cut my hair. Sure, cut your hair. But to make a long story short, he didn't never cut my hair. I did it myself because he was chicken. Bless his heart. But when I cut it off, I looked like a plucked chicken, and I laughed so hard in the mirror because I knew it was going to come up. So why get upset? You know, they kept on saying it'll grow back, and I used to keep my hair cut off anyway, so it didn't bother me too much. But by the end of the 4th week, I have to say it was gone anyway, and I just kept that as I had to go back to work. Well, not that exact time because I kept chemo for like I think it was 16 weeks. I had to do chemo.
Wow.
Yeah, something like that, and I had to go back to work because your insurance, you have to keep it. You have to go back to work because I was in a union, and to keep that, so I did. But because I had 4 weeks saved up for vacation, I took my 4 weeks to do my radiation. So and I got paid, so that was great.
Yeah.
But I try not to look at it like, very traumatic, even though there were parts and times where it was traumatic, like soreness, or I can't really remember the soreness. I knew it was. It was when Shirley spoke. I'm like, yeah, I had that. Felt like something's coming through my breast. But the 3rd time I asked him to cut them off, take them off. And she said, that's what you want? I said, yep. But I didn't mind doing this podcast because one of the ladies at my job had just got her nipples reconstructed. She said, you want to see them? And that's the reason I asked them to take them off. Because when I looked at her breasts, I said, oh, wow, you don't look like Frankenstein. You didn't even really see anything. You go, wow. I said, so if anything else happens to me, I'm getting them to cut them off. And when this 3rd time rolled around, I said, take them off. I didn't have to wait 20 days or, I knew it that day. Just take them off. She said, what? I said, yes, that's what we're going to do. So that's what I did.
Wow. These stories are really something. Okay. Well, the next question is, how did your treatment differ from your experienced cancer more than once? But I don't know. We already talked about that, right?
I can comment a little bit too. Not so much on the breast cancer, but since I've had cancers 5 times, my first one I was treated with something called cryo, and that was precancerous cells that I had in the uterus. That was in 1996. I think I was 30 years old at that time, and then years later, I had something called by this cancer cell called spindle cell. It has a long name to it, and right now I just can't bring it to the forefront of my head to mention the name of it. But it started out as a chicken pox as I had as a kid that eventually I had scratched it when I was a kid, and it was a permanent scar. It started growing. It was right underneath my right side. And that one was treated with something called mold surgery, where you go in and they numb you and then they cut until they get a clean parameters. They keep cutting until they get all the cancer out. That ended up being 11.3 centimeters and 3 inches deep. And if that doesn't come out, that cancer burrows into your lungs. So that was done in the medical office. They pack you, they send you to lunch, they test the parameters of what they took out, and if they find any that cancer is still, in more of that space or that area, they cut you again, and I had to go under again. And I remember that very clearly because we were having a storm. We were having a snowstorm that winter, and they were sending me from that
in
guy.
'96.
Yeah.
Yeah, that was the snowstorm of
That's 30
'96.
inches.
I remember that.
And they sent me. They were going to be sending me the next day to another doctor to close it up. Because I had a gaping hole, and the doctor was stuck down Georgia in the snow, and I said, he said, well, pack yourself. No. You're going to pull that skin together and you're going to close it up. I said, that's what you're going to do. Because if he was stuck in the snow, and I had this open since I'm in the medical field, I know I'm going to be susceptible to infection. Right. And then how am I going to get somebody at home to want to treat me? I mean, I'm leaving with a hole. So I said, just pull. He said, well, it's not going to be nice. I said, I don't care. I don't care about the vanity. I said, close it up. Well, what about if your boyfriend, I don't care about any of that. Close it up. So we closed it up. So that was that one. And then when I got the thyroid cancer, I took something called a radioiodine pill that I had to be isolated in my room for 2 weeks. My daughter, since she was a teenager at the time, of reproductive age, she had to stay away from me. So, and I prepared for that, knowing what was going to happen. So my room was sealed. I actually cooked my meals prior to getting that treatment, and then all my daughter had to do was heat them, put them in front of the door, knock on the door, and then go in the room so I can because I'm radioactive, right? Wow. Everything that I used in terms of silverware, plates, and dishes, they had to be separated. So they went into a trash bag, and they were stored in my basement for 6 months. And then they was disposed because if you put them in the trash too soon, and they find out that it was you, then you get cited for it. So, and I was extremely nauseated with that, and my ducts and the salivation glands, they blocked as well from that treatment. So that was pretty tedious, but I had a strong family. Like I told my dad, he was like, "Oh, what are you gonna do?" I said, "Get me a brand new sewing machine. I'm gonna be sewing." I didn't sew because I was sick, But one of my girlfriends introduced me to Seinfeld movies, which I had never watched before, and I just put them tapes in there and I watched them to keep myself because you're isolated. You're in this room for 2 weeks. Nobody to talk to except through the door or the phone. So that was that. And then with the breast cancer, of course, which I've already spoke about. That treatment was, in my opinion, the most challenging treatment at that time that I had to deal with because up to the actual double mastectomy, lumpectomies, that's surgery. So, I had 3 lumpectomies in there. And then, just feeling, going through them, placing the that little device that they put in your breast so that they can find the cancer when they go to take them out through the lumpectomy. They put a little chip in you.
Oh, yeah.
Yeah, that's even excruciating because they, so all of those things were things that led up to it. So I would just say that's how it was different from me. This one was more intensified, if you will.
You brought back memories. I had a thyroidectomy. They took my thyroid out. I'm like, I had that.
I had it twice because they tested
and that was 2005. I forgot all about
2011 for me for the thyroid. So they took the one side out and they said, "Oh, you're good." And then when the frozen pathology came back, I had to go back 2 weeks later and get the same surgery done afterwards. So I had no voice for a while, but I'm grateful I'm here.
So. Yes, indeed. And with Shirley being a 5-time cancer survivor, I just want to acknowledge that all cancers matter. All cancers matter, not just breast cancer. And we all know that breast cancer awareness is in October, but we're here in the month of January talking about breast cancer. It needs to be talked about all year round. It needs to be acknowledged all year round. All cancers matter. Okay. So my next question would be, so what have your support system been like? Because we all need that support when we're going through something so significant. But
My support is my kids, my family, my mom, and all my customers that I see every day.
Mm-hmm.
I think for me, I would have to say I really dug deep into religion and my faith with God. My children were very strong. Most of my friends, even coworkers, I work with people in the UK. They were sending me things. I had one coworker. She sent me a handmade card every week until my treatment was over.
Wow.
But it's amazing
That's
because there's
nice.
people that are in your window that you don't expect that live up to it.
Right.
Sometimes more than your family. Your family will be busy telling you what you shouldn't get done and how you ought to treat your own body, and making decisions for you.
Mm-hmm.
But like I said, my kids were very comfortable. But there's one lady that I work with, and I won't, reveal her name here. She came to every doctor's appointment I had, every surgery that I had. So, and I was grateful because she comforted my kids at the time when I got first diagnosed. My daughter was fairly young and my son was a little older. She came to every single one of them. She came home with me. She helped me care for myself when I couldn't. She did a lot. And like I said, all my friends were very significant at that time, but this one person went above the rim and just extended herself as much as she could for me.
I had a
That
client send me
sounds
a
like a
card.
friend. That
Mhm.
sounds like a friend.
I had a
Yeah, you
client
met
send me a
her.
card every Monday, and Mondays were my treatments.
Mhm.
So I got a card every Monday that said, "Keep your head up." Like that
Mhm.
was so decent.
Mhm. You'd be
Yeah.
so surprised.
I
The
mean,
smallest thing.
but having that support means so much.
It does.
Means so much.
Mm-hmm.
But I'll tell you, even if you don't have it, you meet people at the cancer center where you get treatment that you see on a regular basis.
Yes.
And you will find that you are coaching each other. You are supporting each other, right? Because the one lady, she told me, she said, she said, change your doctor. She said, I had her, change your doctor. That, if you didn't get the empathy that you needed or what she told me, she said, change your doctor. But they are there and you see them every day and you're all there because this place is only dealing with one thing, cancer.
Right.
So you know that you're all in the same predicament. So you do,
Find other
support systems there.
support.
Mm-hmm.
Yeah.
The last time it was my friend who came and took care of me. I have, like I said, I have 6 kids, but I enjoyed the fact that they stayed home and my friend was there, and he took care of me. I have to say it was great. He cooked, cleaned dishes, vacuumed. He did everything. He would open water bottles for me, and because of his life and what he has to do, um, he left. He would leave for about 2-3 hours out the day, and come back in, cook my dinner. He just took care of me like I was his little kid, and I really appreciate that. That was, and one of my sons, because he stayed there too. He slept at my house, at my apartment, and one of my sons said, "Well, he live with you now?" Like, and the questions that kept coming out of him, I'm like, I was like really feeling angry at him. I said, I'm gonna fix him. I got home, I'm gonna fix him. And my friend said, don't say nothing to him. I said, I'm gonna get him. I called him up on a Monday and I said, I need your help. Sure, Mom. I'll do anything. What do you want me to do? I said, I need you to help me take a shower. Crickets was on.
I know it was.
I said, I need you to help me take a shower. He goes, Mom, well, why can't John take? I said, she's doing. I gave an excuse for her. So I made him wait. He said, Mom, do I have to look at you? I said, how's you gonna help me? What is your problem? How's you gonna help me? So I waited till probably, because I told him on Thursday. I waited till Wednesday night to call and tell him I didn't need his help. But I fixed him. And ever since then, he would say, how's your friend? I said, he's a good man. I said, I know. He's a good man.
I think I was just sharing with you guys earlier. Even you some people that just show up in ways you don't expect. And I was saying, sharing here through the podcast, when I had my mastectomy, you lose your independence. You're in the hospital. You're not as mobile. Your arms are not working properly. You
They
lift
sure
no,
don't.
everything is weak from that. And I couldn't bathe myself.
Mhm.
And I couldn't take care of myself hygienically. And even though the hospital does have the proper staff there to help you, I didn't want I didn't want that. I was like, this is private. This is, this is my
Yeah.
body. I don't want
Right.
you watching me. And I felt like I was losing my independence.
Right.
And so my daughter said, Mom, I will be there every day, 4 a.m. to wash you. And I was so grateful because it was embarrassing for me. And like I said, it's not only you're dealing with the cancer and the emotions around that, you're dealing with somebody having to help you in ways that you never thought you would need help in. It just even helping you go to the bathroom and cleansing you in a proper way. So
Yeah.
you'll be surprised, like I said, how sometimes the support system, and it's not always the family, but my daughter, she asked me for something, she gets it. And I'm grateful to that because she saw me take care of my mother in ways, and my mother wasn't cancer stricken, but in ways now she is reciprocating it to me.
Right.
So
Right.
when she
Right. And
asks
that's
for something,
important.
she gets it.
That's important because we take care of our own. I was a caregiver and took care of my mother when she had fallen ill with cancer, pancreatic cancer, um, and took care of my grandmother also who had Alzheimer's. But yeah, I get it. I get it.
Yeah, you pass
That's
that
what we
trait down to
do.
help each other, and you don't even
Yes.
realize that they pick it up and give back to you. So
Yeah. Yeah. Mm. Okay, so I know we talked a little bit about faith, but how was your faith through all of this? I mean, your trust in God
Well, I tell
get
you,
you through.
it makes you closer.
I would
Yes.
agree. I think faith is critical in this aspect because it's like I shared with some of you earlier before we got on the podcast. Cancer, it's not like a cut, you put a band-aid on it and it goes away. That's not the case. You're dealing with something that's completely out of your control, that's going on in your body. You are up at night when your family members are sleeping, you're crying, trying to figure out if you're going to survive this or not. And the only person that you can turn to is God, right? And so he's, in my experience, he has provided that comfort, that peace. He has put people in my life that when I didn't think I can do it, to strengthen me. Not only that, even today, it's not by accident that you guys are in our life. We have come together by the grace of God, right? And sharing the same type of story.
Yes.
So for me,
Yes.
having
Amen
him in
to
my
that.
life, giving that hope, uplifting me when I couldn't uplift myself. Even if I just read scripture a couple of times, it would just help me get through what I needed to get through. So for me, I'm stronger in that. And every day is a gift and an opportunity for us to be a blessing to someone else in their life, right? So I don't
That's
know
right.
about you ladies, but since you've had breast cancer, I don't know if you notice it, you become aware of people that have the same thing, and God puts
And
you
you
in
gotta
that place,
speak to them,
and you
don't you?
speak to them. I have done that for 5 women already. I have been in stores where I might have had on my breast cancer survivor shirt, and somebody will walk up to me and hug me and say, how many years are you? And I'll say, I'm so and so. How many years are you? So God puts people in your life sometimes you don't even realize that's happening.
And one of the reasons why they said I had breast cancer was because you ever heard of when people carry their cell phones in their bras?
The radiation.
So they said that was one of my causes. So whenever I'm out at a
Really?
store and I see a
Wow.
woman with their phone in
Phone
there, I
in
have
there.
to talk to her. I have to walk up to her and say, "Can you please don't do that?" And then I tell her my story, and then they remove
What?
it and say they're thankful that I,
Wow.
said something. So it does give you you become this advocate for other women. You just believe that you have to save the next person. Like it's a lot. Yeah.
You even carry them in your back pocket.
Just on your skin, period.
Yeah, I think they
On
had
your
a special
skin.
on that some time ago, but that is true. Certain things, and I will just say this: even wire bras is a problem.
Yes. And I'm like, why we find that out after cancer?
I
Why
know.
is this just something like with my daughter? She's 19. I'm like, no, we're not doing that. I don't want her on birth control. I have her on IUD instead because the depots, the pills, all of those things bring on cancer. So it's like the things that I'm learning now, It's like, okay, let me start putting that in place for her, making her know, before something comes up. Yeah. Mm-hmm. But yeah,
Wow.
underwire, no.
Yeah, and I can tell you, I remember, and I wonder sometime if that was the cause of me having it. I
Because of the
remember,
rash, right? Mm-hmm.
yeah, I had a wire brow one, and the wire kind of popped through the fabric, and it dug in my skin, and it opened it up, and it got infected a little bit. You can't tell me that that wasn't part of
Mm-hmm.
that, because it was rusty.
Mm-hmm.
So I will not wear them now. It was rusty, and so that exposed me to that, for a while. But
Oh, wow.
yeah.
Well, I'm learning a lot here today, just listening to all three of you.
Mm-hmm.
Because I wear wire bra,
Yeah, you should
and
stop.
They're not good for
but
you.
by me being top heavy, I have to.
No,
No,
they built them.
they got you got a store close to you that
believe.
does them. They're expensive because
What, the one on
our
the
close friend of
fairway?
ours took me there.
Yeah, I go there. That's where I got it from.
they're
Or if you go to
But when
J,
you top
what's it called?
heavy,
J&,
you need.
you ever been in J&, Intimates?
yeah, and you can get them without the wires in them, because I'll tell
But
you,
is it going to lift me
Yes,
up?
it
Is it
will.
going
yeah,
to give me some
Yes.
support?
but they are
Yes.
expensive.
Y'all might have to take me by the
They
hand
are
and
expensive.
take me there.
But our mutual friend knows them. That they are expensive. They are
Yeah.
expensive. But I was going to say,
take me
because
by the hand and
after the
take me there,
mastectomy,
because
I
I
had to
don't know
have
what
something
they
special
talking
Yeah, that's what I
put
have.
on. I can't wear anything wire, and I have to have something that comes down, because anything that sits under that scarring from the
it's going to irritate you.
Yeah.
And you can also get it covered with your insurance at those places.
Yeah.
Like the place I go to, the insurance pays for it.
And some of the department stores as well.
Mm-hmm.
Okay.
But you don't know to ask for it, but you should not wear a wire. It can cause something.
Lord Jesus.
Yeah,
because
my
I have
sister
one on
took care of
now.
my mother, and that was a topic, because she has 2 girls, and that was a topic that came up when I was visiting my mother, about don't wear bras or wires, and I kept wearing them.
The first time I ever heard of it.
Yeah, you don't hear about it until you get breast cancer.
Then you hear about
you.
it. Yep.
Wow.
I really
You
thought
do
after
not.
they
They give
told
you so much education. It's crazy. After.
I even found out, like, when you go in the supermarket, you eat from the perimeter of the market. Don't go in the house.
Like lunch meat.
I stopped
All
that
the
stuff a long
processed
time
and
ago.
parasites in lunch meat. I will never touch that. You can't get me.
Yeah,
to touch
and
it.
that's going to be one of my questions too, about how has life changed you since surviving with breast cancer? Because I want to know now, after cancer, how your eating habits, or what are you doing now that that you was doing back then that wasn't good for you, that you don't do now?
Well,
You know
number
what I mean?
one, I
Because
do not go out with people and drink alcohol all day. Alcohol and the sugar in alcohol breeds cancer, especially if you have a cancerous body already. So
yeah, because
just socially drinking,
cancer feeds off of sugar.
I don't put sugar in my food. I don't add it to coffee. Like I only drink water. And if you put sugar in my food or in my drinks, it tastes weird to me. Like I don't like it.
That's because you don't do sugar, and so you're not used to it.
And I try to eat food. Like I go to the produce place and get my produce. I go to the meat market and get my meat. I barely go to the supermarket. I don't have canned food, all that processed stuff.
Yeah.
And if you look at how rich people eat, they know every ingredient in their food. It's like 5 ingredients. That's it. So that's how I try to eat. Like I try to cook my stuff and know what I put in it.
Right. Has your eating habits changed for you since having cancer?
I would say yes, because not just the eating, just other things have changed for me. So I don't want to focus so much for food, but for me, I became acutely aware of life, right? More sensitive to this thing. I can watch TV, and before, if I saw somebody with cancer, it didn't bother me. Now the tears are rolling, right? And I'm just it's kind of like a twofold, and sometimes it comes with age. But the word no has become very prevalent in my life, right? So I think it's a combination of what I've gone through, and that I've learned that life is precious. Every day is not given to us. So there's certain things that I will put up with people, and certain things I won't. So I think I was already bold before, but I'm more emboldened. So I don't have a problem. I'm not going to say I'm not disrespectful to people, but I will set boundaries. And when I see people are trying to, manipulate and abuse me, whenever I step, but that's all with cancer. So and I'll tell you another big thing that I've learned. Some people can't do anything by themselves, right? Cancer has made me, if I want to go to lunch or dinner and I don't have somebody to go to lunch and dinner, I go.
Yep.
I go to the movies. The first time I went, I felt like my ears were 20 feet away from my head. Guess what? I go. I've learned to love me first, and that it's nice if you do have a girlfriend or a partner or a husband or boyfriend, whatever the case may be. But if I don't, my friends would they like, well, I'm at the diner. I'm having breakfast. By yourself? Yes, I am. So I've learned to love myself a whole lot more than I did before, and live life to its fullest, because tomorrow you can get that knock or that phone call that you got something that is life threatening, and you may be able to get it eradicated and you may not. So that's how it's been for me. But in foods, like, I have reduced some of my things that I don't eat a lot of different things, but for the most part, it's for me, it's more awareness of my life.
Mm-hmm.
So,
Okay.
Yeah,
Now,
I've
what
had
about you?
my radiologist. I saw him first before I saw the cancer doctor, and he sat me down like I was in an auditorium with millions of people. It was just me, and he talked to me like that's where he was, and he taught me you don't eat even ketchup.
I can't have that. I can't have no
Heartburn.
tomatoes.
Yeah, well,
Heartburn.
Acid
Me
reflux.
too.
Oh my God. So I don't do
but
tomatoes.
he was saying whatever you do, make your own stuff.
Right.
Make it yourself. Don't go in those. So I've learned to the lunch meat counter. I just walk past it because that was the first thing he talked about was
What
foods
lunch
with a
meat?
lot of. I tell my kids that too.
Yeah, the
Here you got
processed food
cookies on the
no,
shelves
it's no good.
for a year and a half, maybe. When you look at why, it's just like I stopped eating some fast foods. I won't name any, but because I was told here's a doctor who has the whole meal in their office, and you go in there and she can pull it out, and it looks like you could eat it right then. I learned that because my grandkids, it was during a hot summer, they were, can we go? Can we go? To the fast food place. And I take them. I didn't know then. When I go to clean out my car, and it's been a month, and you got that food that they dropped in there.
The French fries,
Oh,
and they
and it
still
ain't
look like
even
them
molded,
same French
right?
fries.
No, it never molded.
Yep.
I'm like, what in the world? In a hot car, sitting
That
on
should
the
tell you
sunny side of
something.
the street. Yeah, I said, oh heck no.
We got chemicals, so many chemicals in
Yeah,
foods.
yeah.
And
Wow.
I sat up the second time I had cancer, breast cancer. I sat in front of the TV and watched a podcast. Well, whatever, documentary, whatever it's called. And it's in everything. This, your sheets, your towels, your dish detergent, it's everywhere. The way they talked, I was like, oh well, we'll get through here with God's help because it's in everything. I don't use air sprays, no, air fresheners, no aerosols. I don't. Um, I I thought there was a lot of things that made me stop. I said, it's not going to do that either. So I don't. Um,
It just makes
because
you
of what,
aware.
it makes you think, if I don't need it, then I don't need it. I'm not going to,
And
and
you
that's,
notice you don't spend as much. Like I don't shop for just anything anymore. You know what I mean? Like I used to be like a shopper. Like,
Yeah.
But now it's like what I need.
Yep.
You know
It's
what I
about
mean?
what you need.
Mhm.
Because if I don't need it, why am I bringing it in here? And it could be.
Right.
Yeah. And I won't say the name of the company, but those things you get from overseas, I'm not getting it. If you look on the back of some things that you buy, this maybe this. I'm just saying, not this, but it would say it could, like it was a as a matter of fact, it was a little refrigerator that held
A couple canned sodas.
yeah,
Mm-hmm.
or makeup for kids. You know, little girls know they want the makeup. Look on the back of that. It says it could cause cancer in California, but it ain't gonna cause cancer in Pennsylvania. I'm not
Yeah,
I'm not,
right. You right about
I'm
that.
not buying it.
You right about that.
Yep. I said, oh, I wanted one of those little things because I could live in my bedroom and be lazy and drink my water. You know, I don't have to get up and go in the kitchen. But
That reminds me because I had bought this exercise equipment, right? And but when I got it, when it was delivered to the house, I had to put the exercise equipment together myself. I'm good at putting things together. And as I was reading the directions, it said at the bottom that the exercise equipment causes cancer.
see,
I
That's
was
what I'm
like,
talking about.
where? Why? And what? I
Yep.
spent all this money
Mhm.
to get this exercise equipment. And it said that the thing causes cancer. So you know where it is? It's back there somewhere. I didn't even hop on it because, you know, the
It
thing
makes you
causes
sick.
cancer. Why is
This
that?
could be the
And they
government
got
sending
all
it.
my money.
I say it like that. But yeah, it's a lot of
Should've
things
sent
that
it back.
I looked at different things. I was buying it for my granddaughter, the little refrigerator, because she does makeup and stuff, and I was going to give it to her. So I had to send that one back and order something else that didn't have that, whatever was in it. Um, and years ago, I'm thinking the breast cancer came from was a hair dryer that my sister-in-law had, and she said, "No, you can't use it." Let me use it. I need it. You know, so I used it, and I ended up going, "Oh, whatever was in there, I don't know what it was. I can't remember, but whatever was in there, I threw that thing out because it wasn't good. It made me feel weird, and you know, but that was years ago, probably before I had my first son.
There's so many environmental
When he's
things.
You know,
54.
we just live in an environment because if you think about the history of cancer itself, when I think about my grandparents or maybe even my great grandparents, um, you didn't hear about cancer
You
back
didn't.
in the 60s or 50s, but now
It's rapid.
it is so, I mean, it's just more common now because I don't know the food industry,
It's in
you
the
know,
dirt.
or the
It's everywhere
chemicals.
though. It's in
It's a
everything.
combination of
Right.
everything,
And
right?
you think about it, people trying to preserve food for longer periods of time so
Right.
that you can eat it and it doesn't go bad. It's in almost everything. Like I said, even your fruit, you got the waxy color on your apples and stuff. So I usually clean my fruit with vinegar to, to get some of that stuff off. But it's in everything. It's in
Well,
everything.
what about organic? How you feel about that?
It's
Because
still in the
back
dirt.
in the day, everything was organic. You didn't have to pay more money to get organic food, and then all of a sudden, um, you know,
One of the
farmers started spraying the food with pesticides and all that stuff. So I don't know.
one of the things I did find out that United States, where we live, they allow things in our food that they don't allow in another
In
country.
other countries, yeah,
They will not allow it somewhere
Yeah, I
else.
you're
saw
right about that.
a
But they
special.
allow it here. It's all got to do with money.
I won't say the names, but I read an
Yeah.
article about 2-3 months ago, and some of the cereals there are permitted to have a certain amount of plastic in them.
Mm-hmm.
Okay, and even the grated Parmesan cheese,
Oh my gosh, yes.
certain one of those, they are permitted to put a certain amount of wood grain in there to supplement it, and it's acceptable.
Mm-hmm.
So, but I think with this topic with food with cancer,
It's in the clothes too.
it's everywhere, and you know, so you just have to be careful no matter what you do, because we're just in an environment where people are greedy for money, and so things are done to allow them to do those things, and sometimes they're using things and chemicals that we shouldn't have be exposed to.
Yeah,
I see
I
that.
agree. I think I don't know. I've changed my eating habits just because of those things that we're talking about. I'm pretty much plant based now. I mean, and it's hard. I mean, and you know, sometimes I fall off the wagon,
Oh, absolutely.
but I get right back on because I know that processed food isn't good for me. All those things, and I try to do organic things, you know. So
When I seen
but,
that
yeah.
the snake had cancer, I was like, wow,
A snake.
a snake had cancer. It was an article I read, and it was talking about the bones and whatever, and had cancer. I'm like, wow. My sister's dog, well, her daughter's dog, had cancer and died. A dog. And it's in
Yeah,
everything.
and one of the ribbons on that thing has pet cancer. I was like, wow.
Yeah. So,
Okay, well, let me get into the next question here. Okay, so do you think you ladies have a second chance at life, and you know, after cancer? I mean, it's just one of the questions that came up, but I think we all can attest to that. You know, we live in life like it's golden, and thankful for the second chances, second, third, fourth chances of life. Always thankful about life.
Yeah, I agree with you. And again, it's an opportunity for us to share our story, to help others along the way, because we're certainly not going to be the last to have walked in this journey and to have crossed cancer, as you say, not just breast cancer, but any type of cancer.
Right.
So yeah, I would agree to that we've had the opportunity.
Yeah.
You know,
and anybody that sees this, I would say, because I work with a girl who was afraid to go see about anything. No, I can't go. I'm like, go. She ended up dying because she would not go. You know.
Yeah, she had more fear than she did in the process, but you know, I don't want to go in there. But there's a lot of people that are like that. Not just with going to the doctors. They won't. They'll do other things, but they won't go to the doctor.
Right.
They don't want to know about it. And I do know persons that had cancer. They went to the doctors, but they didn't want to hear. They just wanted them to do what they had to do because they couldn't process it, but wanted me to be explaining everything to them. And you know, but you got to self-love. You have to self-care for yourself. And sometimes people rationalize with things that, and I'm just going to say, this makes no sense to me. Okay. You talking about work and how you got to make money. But if you deceased because you didn't take care of something that could have been easy eradicated, like I would say my breast cancer was one of the easiest ones to be taken care of. There's different types. Why wouldn't you go to the doctor? Now, why would you put that on your family to watch you suffer? Cancer is not nice. And by no means, when you see somebody that has gone through it and they're suffering with it, and even if they got treatment and it's not working for them, it is not nice. So why, if you have the opportunity to get something done for it, where you can sustain your life, why wouldn't you do it? You let fear, and I'm going to just go out there spiritually, you let the devil put that fear in you where you won't even take yourself to get it taken care of. when God puts something before you to say, here's something to help. I might not be doing it, but I'm going to put this person here that's medically qualified to help you along the way.
Mm-hmm.
So
and I just believe that they've done this treatment so many times that they do know what you need, you know. But some people's belief in even holistic, it boggles me that you can say, no, I'm not getting that. I'm going to get this. And then it's progressing and you still believe in it. Like, I just don't understand it. And it's like, whatever they said I needed, I just went and did it. You know what I mean? Just like put my pants on and go fight.
Yeah, your big girl pants.
Yes.
Yeah. Yes.
Go fight. That's what you do. And you think of your children. She had young kids too. I thought about, I had just adopted my daughter that I wanted so bad. I wanted a little girl. And I just adopted her. And then I didn't want the chemo because I was married and I didn't want my hair coming out. But the second time around, I said,
yeah, it's amazing the emotional trauma on a female.
Women with hair.
Right, with hair, because you worry about.
Our hair is everything.
It's our
to
glory,
us.
right?
Yeah,
we're worrying about how the male's going to perceive us when we don't have no hair. Then if you have a mastectomy, depending on what type of augmentation you've had done, how they're going to address and deal with that, you know. So it's a lot of things physically, emotionally, that you have to deal with when you go down this road and travel.
Just gotta love yourself.
And love yourself, and you got it. And if you don't have that self-love, and I mean, I'm going right back to taking care of you, making sure you do what you need to do. Forget if the guy tell you high maintenance. If doing your nails and going to get your hair done makes you feel good inside, do it. You ain't got but one time and one life to do and cherish yourself. You deserve it. So, but it's a hard battle just dealing with that, you know.
But there's a lot of people. There's a lot of people that will be in your corner. I think. You know, I'm talking to somebody who just found out that they have breast cancer. I think look it up. Look up
educate yourself.
Right, educate yourself and find people who've been through it.
That's right, because that's the best, for me, that's the best medicine when you can connect with somebody that has had it, has walked. And again, your journey might be slightly different with treatment or whatever, but the fears are the same.
Fear. Oh, yes.
Right? The reality is the same. And so I have opened it up, and I've had girlfriends up, call me anytime of the night. I will wake up and talk to them because I know what that's like. Call me anytime of the night and we can talk. You know, I want to get you through this. And again, to me, that's what our purpose is. You know?
And that just runs into the next question that I was going to ask, and you spoke a little bit about it, but have you become an advocate for breast cancer awareness? And I know that you spoke at different, functioning about breast cancer. So what was that like for you?
I have had the opportunity in 2024 to speak at the Divine Ministry Pink Gala. It was a mentorship program, and it also was addressing women with breast cancer. And so I did speak there, and during my speak there, I that morning I hadn't figured out what I was going to write. And sometimes I dislike myself because I'm a pre-planner. I got to think about it. I got to write it all out, organize it. And then I hardly never
Don't look
use
at it later.
Right? What I did this morning, right? And in that particular speech, one of the things that I had related it to was, God gives us senses, right? He gives us smell, taste, touch. And we have to be in tune with those things. And the way I described it was, we don't realize how magnificent God was. If you get a mosquito bite, after that mosquito has numbed you, and that numbness where you know immediately that something didn't happen to you, you immediately touch it. That's the grace of God that gives us senses to let us know that something has happened. And that is the same way with cancer. There's something that happened where it was something felt abnormal. Whether you got a pain, whether you felt a lump, whether you got, a rash, something has happened. And so I have spoke to women, and gave them some, planned time points in my life and when these things kind of happen, and just knowing I'm just grateful that God did it, because every single time I quit it early enough to be able to have something done with it And then also, I have helped other women. I have helped 5 other women to date with their breast cancers. I've been through their surgeries. I've supported their family.
Oh,
I've
wow.
also, when I had my breast cancer survival party, I had the women that came donate money, and that money was donated to the hospital where I had my treatment to help other cancer people. Because what people don't realize, when people come in there for cancer treatments, depending on their financial situation, they don't have transportation to get there to get that treatment every day, right? Then I won't say, but I remember there was a guy there. He was coming in getting chemotherapy. It was below 0, and he had no coat. I went and bought him a coat and gave it to him, because I knew that you already coming out here struggling with what you have to have done and your chemo, and then you have these things. Some people don't have food. And when you get your cancer treatment, I don't know if you experience it, they ask you these questions up front and periodically during your treatment, because any kind of stress is not good for a cancer survivor person while they're going through treatment. It's not good. So we donated a little over $500 to that facility to help. And then most recently, I've participated in an interview with Divine Ministry Again magazine. It was my first magazine interview, which I believe you're gonna be sharing it with you all. So my testimony will help somebody else down the line. It could be somebody that's just afraid to go through, and hearing our stories may help them go to the next line, the next step, as we move forward through this journey. So for me, I've given back. I've even made baskets for them to donate off and to the cancer people, because they have dinners once a year to recognize survivors, and depending on your organization where you got your treatment at. And I've given them those baskets. I just made them and donated them out. But I wouldn't say, I'm not an advocate where I'm going online saying, hey, by the way, do you have cancer? I can help you. But when God puts somebody in my circle and they are stricken with cancer, I tell them, same as you. You see people, you be like, honey, you might not want to have that here. So.
And I know that since I've had it, with my organizations that I'm in a couple of organizations, and we do charity work. I had created a chemo box, because I know it's different things that you need when you have chemo, like your nails are going to turn dark. So we put dark polish in there. Your eyelashes are going to come out. So there's eyeliner. There's the little things you put on your eyes to get rid of dark spots. And I have like a little letter in there, and it just says all the things that are in there. There are soaps with no parabens and no additives. There's lotions. It's like so many little things that I know that chemo person needs so they can be comfortable with, like the hair loss. There's a wrap in there. There's soft socks in there. It's like all these little things, and I donate that to Fox Chase Hospital every year. And it's through the organization and my hair salon that does it. And I usually have a person, they sponsor a box for $15, so we can put everything in there and give it to the people.
Wow, that's wonderful. The work that you ladies do are wonderful.
But it makes you give back.
Anything?
No, I just remember when I would go to get my treatments, that they wanted to give me a wig. So I said, just give me a nice little short one. Now we want to give you the length of your hair. I'm like, that's not necessary. Who cares, But they gave me a real long one, and then they gave me a small, little shortcut. And I put it on. By the time I got to my appointment, I had ripped that thing off. I don't want this. Where's the box with the hats and the scarves? So that was there automatically. A box with people knitted
Blankets and stuff.
and crochet. That was very, very nice. And I got like every color I could get. And you know what? I haven't done it yet, but I do sew. And I was going to make a little small blanket out of those pieces that I got. Because they weren't, but just patches. Enough to tie on your hair. But what I appreciated was when I went back to work, people who knew me, customers, my fellow employees, they all looked at me, because you can rock that, because I had no hair. I was buying it. You can rock that. And even though I thought No, I can't.
Mhm.
You know, they gave me that encouragement to don't even look at that and just
Yeah.
keep going.
Mm-hmm.
Oh, wow. Wow.
And eventually, my hair grew back.
Mm-hmm.
And it was, I mean, that didn't make my hair grow back. Because I heard some people say it don't grow back. But it did grow back, and I'm appreciative of it growing back. You know, that it's there. Um, but I haven't.
But you are.
Mhm.
I'm going. You are. You're advocating right now.
Well, yeah.
Yes.
Right
Yes.
now.
Being
Right
on the
now.
podcast,
Right now.
you encouraging someone who's
And I
going
hope,
through it now.
I want to say to that person who's looking and watching, go and get checked out. Don't be afraid.
Mm-hmm.
Yeah, that was my next question. Yeah.
Mm-hmm.
What would you say to women who are afraid of getting a mammogram? What would you say to them?
It's
You should
nothing
be
to be
afraid of
afraid
not
of.
being here. Go
Yeah,
get the mammogram.
Yeah.
get the
Yeah.
mammogram.
It's really
Yeah,
not
get the
that
I
bad.
mammogram.
I agree
And what
that
advice?
they should not fear the mammogram. They should take self care, self love, and get themselves treated.
Mm-hmm.
As we all know, early detection
Oh
will
my
save
goodness,
you.
yes.
You might have reoccurrence, but early detection may save you.
Mhm.
And I was stage 3 going into 4. I didn't mention that.
Wow.
Mm-hmm. And they said, "Oh, we feel nothing. Oh no." So
Yeah,
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 don't take
and
it.
I
that's
could
the
not be
thing.
here.
You have to be your own advocate. You have
Mm-hmm.
to push for if you only you know your body, and you have to be tuned in to your body. Only you know how you feel, and when you feel as though something isn't right, you have to push for it. You have to go and get it checked out, and and I know that all of this is scary. It is. It's scary,
Mm-hmm.
but what you know you, 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 you don't need to weigh out no pros and cons about this.
No.
You know, you feel something isn't right, I strongly suggest for people to go and get
Yeah,
themselves
people
checked
tend to
out.
dismiss. Oh, it'll go away. Oh, that's nothing. It's this and that. And dismissing can be you dismissing yourself to 6 feet under.
Yeah.
So I would just say, as we all have, get the mammogram. It may, just go through the testing and make sure that you are here for yourself. And if you have family and your loved ones, get it done.
Yeah.
And don't wait, because it might be when you're in a stage. I was fortunate with my first one. I was in stage 0 for DCIS. But sometime by the time you've recognized or realized something's wrong, you could be in the 4th stage. And the 4th stage means it then traveled outside of that area that it started, and it then metastasized to another part of your body. So now your chances of survival is even more complicated and complex because you've allowed it to spread. So, and I will tell you, when I was going for my checkups, and I know you ladies probably do that too. You go every 3 months for blood work. You go back for you don't get mammograms anymore, but you go back and you get your checkups once you get the double mastectomy. And the doctor will tell me, Shirley, I'll see you in 1 year. I said, no, you will not. You'll see me in 6 months.
That's right.
Right, because in my
That's
mind,
right.
that's 1 year that something can be going on and rapid out of control. And I can't tell you, I have family member that his legs was hurting and hurting and hurting and hurting. And he didn't do anything about it till he couldn't walk. By the time he went to the doctor, he had cancer in his leg, in his back, in his chest. He lived for a week after he found out, because he, I want to say, but men tend to ignore things and be like, I'm fine, I ain't doing, I ain't going to no doctor, you telling me nothing. But and some women do too. But I got insurance. I'm in there every time. I don't care. We just saw you. I don't care.
Yeah.
You're going to see me again.
That sounds like me.
Yes.
Well, they told me I didn't have to come back for a year.
And I know you ain't listening either.
And I wasn't there for a year. But I had a headache for 6 to 8 weeks. And I didn't ignore it, but I just realized I have a headache. I need to go back and see. So I went back, asked them to do an MRI because this headache won't go away. I am now going through brain cancer. I just had rang the bell 2 weeks ago on a Monday. I had a radiation treatment. So right now I'm just waiting to see when I have to do chemo. But yeah. So I'm a brain cancer survivor for the moment.
Oh. Well,
Because I'm going to survive
we're
it.
gonna
See,
claim
when
that
she
right
told
now.
me that, because I spoke with all the women before the podcast.
Mm-hmm.
When Myisha told me that,
She
it,
bust
it
out
brought me
crying.
to tears. See, I didn't want to cry on my own podcast, but you know,
But
and
it's not sad.
I asked
It's not sad.
Myisha, "Are you going to be okay to do the podcast?" Because she said all this happened 8 weeks ago, and then 4 weeks she said that she got treatment, and so it brought me to tears when I spoke with you on the phone the other day. I was like, and then that's why I said, you know what, all cancers need to be
Talked about.
recognized. You know, it's not just breast cancer, it's everything. And then knowing Shirley's story, 5 times breast cancer,
What's
5-time
DCIS?
cancer survivor.
I've
What's
learned.
DCIS?
Ductal carcinoma in situ. So ductal meaning the breast ducts.
Okay.
So
I
here I
learned
am
over the
crying
years.
again in my podcast.
It's okay.
Look, it's okay. It's okay.
But we're gonna
But
claim that
listen.
she's gonna be healed.
Yes,
That's what we're gonna do.
yes,
We're gonna claim
I
in
yes.
was
Jesus'
about
name
to
she's
say
gonna
that.
be healed.
Stop calling that thing yours. It is not yours. Don't call it yours. I never called cancer mine. No, don't belong to me. It was there. I'm not accepting that.
You're right.
I'm not calling it mine. Here's the cancer. I'm like, okay.
Get that out of here.
Okay,
Like that.
one last question. Okay, what gives you hope today?
My
Jesus
kids.
Christ.
So for me, it's God, right, and my family, and the fact that I'm able to uplift other people that are taking this same journey, and I don't care what kind of cancer it is. That's what gives me hope, and I'm also going to say I'm eternally grateful for meeting you two young ladies today, because you're very special to me today, and you're now in my window of circle of friends.
That's a good thing.
Oh, that's
Yeah.
nice, sure. That's nice. Well, listen, everybody. I just want to stress again that to stay in tune with your body. Don't ignore the warning signs. Get yourself checked out. Don't be afraid to get a mammogram, please. Um,
Don't wait till
Yeah.
you're 40.
yeah, yeah. You know, so this was a special edition of Girlfriend Therapy Session with Dee, and I'm just so grateful to these women who shared their stories. And I hope it uplifted you and have given you hope for those who are walking the walk now. And, you know, this was really, I'm glad I was able to bring these women together today and talk about cancer. I've learned a lot myself, but I want to do this again. Hopefully, we can do something again like this again, you know, to keep people inspired and for them to stay encouraged for those who are walking the walk. I do have some friends who are going through other cancers, and so this podcast is for them as well, letting them know that I'm thinking of them and I'm praying for them. Okay, so but this ends this portion of Girlfriend Therapy Session with Dee. If you enjoyed our podcast for today, we ask that you click like, make a comment, and subscribe. So next time, may you all stay blessed. We'll see you soon. Bye bye.